Welcome back to Startup Health Now. My name is Unity Stoakes, co-founder at Startup Health. This is the podcast where we get to have deep and meaningful conversations so we can get to know the change makers, the entrepreneurs and innovators who are transforming health. Stick around, it's going to be another great show.
I want to pass the microphone back to Unity Stoakes. Before I do, though, I want everyone to acknowledge one thing, which is 15 years ago when Unity and I were first here, when he talked about meeting Margaret Laws at a Mexican restaurant to tell her about what we were working on, Unity would describe how he wanted to bring people together at JPM. And it started out with Startup Health Cafe. If anybody was at Startup Health Cafe, before it was even the festival, the Startup Health Festival then came and took over Market Street for many years. And today we're at the Apollo House, and I can tell you it would not happen without the leadership and the guidance of Unity and the dreams of Unity Stoakes. So I just want to say thank you for putting this together and truly leading the team to doing that. And with Unity, I am incredibly excited to have Vinod Khosla. He needs no introduction, but what he does need is a quick moment of gratitude. For the last 15 years, Vinod has been joining our community at every event we've done, almost systematically since 2013, maybe even 2012, talking about the world we're living in today. If you go back, there are videos on YouTube at the Startup Health events talking about having a doctor in your pocket, talking about how it's going to impact the world. So couldn't be more excited to introduce Unity and Vinod Khosla, our fireside chat. Thank you.
Thank you, Steve.
Thank you.
Good to have you.
Thanks.
All right. Welcome, Vinod Khosla, to the Apollo House. Today we're talking about health moonshots in the age of superintelligence. And I thought we would start with, I think it's the tweet that is pinned now on X for you. I'm just going to read it because I think it's really beautiful. At 70 plus, I feel like I'm 30, backing exciting innovations, making the impossible possible, and from improbable ideas to world-changing, socially impactful companies. Never had such a fast learning rate in my life or felt I could have so much impact, which is exciting. Wow, at 70. Okay, now that tweet was maybe a week ago, so things move so fast. Do you still feel that way?
It's still true.
Is it still true?
Even more innovators today than yesterday.
Why do you feel this way? What's going on?
What's going on is, from time to time, platforms change. I started my first company in 1980 when the microprocessor came along, and a whole bunch of stuff was built on that platform, including the PC and all that. In 1996, the internet came along, and a whole bunch of companies were built on that platform. In 2007, the iPhone came along, and a whole bunch of companies were built on that platform. If you look at the AI platform, it's broader, bigger, and more impactful than anybody could have imagined a little while ago. I was optimistic.
This. You were talking about this years ago. You wrote papers on this years ago.
So it was 2012 when I wrote two blogs that were highly controversial then. One was called, they were in TechCrunch, so they're there to look.
Is this the 20% doctor?
No. So the first blog was called, Do We Need Doctors? My thesis was, with AI, we don't need doctors. Some people still doubt that a little bit, but most people are coming around to that point of view. The other one was, do we need teachers? And that's also true. That was 2012. 2016, I wrote a 100-page document called Do We Need 20% Doctor Included? And people are now coming around to the point of view that this is real. It sounded loony 10 years ago. Even 10 years ago, it sounded loony to be talking about this. It was 100% clear to me it was only a question of when, not how or if. It's very clear now. There's no area of endeavor where humans will be better than AI. Well before 2035, likely well before 2030. That's a good place to.
So we started.
How many people here are physicians? Quite a few. I had a conversation recently. Ike Emanuel, who most of you probably know, came up to me and said, 10 years ago when you were talking about this, I disagreed with you. I think I was wrong. And he said, oh, by the way, you were wrong too because you thought it'd take till 2040 to get here. So when somebody as conservative as him, as a denier, somebody who didn't acknowledge it was possible 10 years ago, comes around to the view of it's happening now and it's happening really fast, it should be obvious to everybody.
When we started Startup Health about 15 years ago, it was a 25-year plan. We're now 15 years into that. And still, there's so many people that have no access to care. There's major challenges. We're not seeing the outcomes. It appears on one level that there's not enough progress that's been made. At the same time, if you ask me, I'm very confident that within another decade, it will be possible. Where do you sit? It will be possible to achieve more of a global health where billions of people, you talk about someone in a village in India maybe getting better care than someone at Stanford. What do you think today? Where are we going?
That's the exact quote of out of my 2016 100-page paper.
Right.
I'll get better cardiac care in a village in India than I will at Stanford because Stanford will have humans and the village will have AI only. I totally believe that. So there was a recent study by Arnie Milstein's group. Arnie is at Stanford, probably one of the best known names in quality of care in the US. And his group did a study that said for complex diagnosis, human accuracy was 73%, which was considered decent, which does mean decent means 27% of the people got the wrong diagnosis or suboptimal diagnosis. To me, that's shocking. And this is complex, so it's not your flu. You can diagnose flu wrong and you'll be fine. AI was at 88%. And then they gave the AI to the doctors, and the doctors improved. But from 73% accuracy to 76%. They degraded the AI from 88% to 76% by introducing the biases. That is the nature of human involvement in complex stuff. That's an actual, and it was a rigorous multi-center study. It wasn't just like a few questions here or there.
So there's this friction there's this system we have today, especially in the West. It might be easier to just start over, but we have the system we have. How do we confront that challenge, that friction, and merge these worlds?
So let me come back to that in a second. Let me take a little diversion. We've heard, now, you'll say, hey, GPT-5 can do mental health therapy, and you hear about that. Then you hear all the stories of chatbots run amok, driving people to suicide. What's going on? My view is very simple. A chatbot isn't designed for clinical therapy with high acuity patients. If you use it for that, it's like driving a car without a steering wheel. And you're going to run into trouble.
Like a Waymo.
Waymo took 15 years to, I think it was 15 years ago or 14 years ago, I first rode in a Waymo. It wasn't called Waymo then.
Yeah.
And I've ridden in every generation since. You need entrepreneurs like these to tailor this general AI capability into a specific solution that does the appropriate level of guardrails. If you're trying to generate an image for your company logo or something, you don't need guardrails. The general systems do pretty well. You're trying to prescribe something to a patient, that could be critical. And so I think entrepreneurs need to tailor this general AI for the specific purpose and do the right risk-reward trade-off. So I think that's what's going on. The capability is there, used out of the box irresponsibly. It's a bad idea. So how many people read a paper in Nature just a few weeks ago called The Fragility of GPT-5? A few hands. It's an interesting paper. It essentially talks about if you use GPT-5, everything that goes wrong. And they were looking for things to go wrong, so it did go wrong. I penned with the AI person from one of our companies, I penned a response to it, which I haven't had the chance to publish. I was being too busy. But everything in the paper is right. What's wrong about it is they use standard out-of-the-box system without the right fit-for-purpose controls, guardrails, approaches, post-training. I can talk to a lot of things. Where the optimism goes wrong is from people who don't know how to use it, using these systems poorly, and then declaring either they don't work or wow. The fact is, the reality is messy, and you have to do this.
So you were one of, if I'm not mistaken, one of the first venture investors in OpenAI. What did you see then, or what were you betting on then? What were you hoping for? And has it surpassed your expectations, or where you thought?
Well, it clearly has surpassed my expectations. Nobody expected, I didn't expect, they didn't represent that capability will develop this quickly. Why did I invest? There was lots of things wrong, including it was a nonprofit, and there was no product plan, no plan to ever sell products or any of that. I invested because the consequences of success were so high, and that has borne out right as a thesis. Well, so my view was, whenever it happens, whether it happens in 5, 10, or 15 years, the consequences will be large enough, so we'll figure out how to get a return. And that's exactly what's played out. Nobody would, it was 3 years ago that ChatGPT was released. Nobody would have predicted something could grow 5, 6, 7 times faster than TikTok did to 100 million users. Now approaching 1 billion users. That's a pretty damn large part of the population.
How do we channel this with this human intention, with this, to direct this extraordinary opportunity, the power of these platforms and technologies, and instead of racing towards whatever humanity's last exam or whatever they're competing on, towards solving these health moonshots?
So when I wrote my paper in 2016, it was long before ChatGPT or even transformers or any of that. I had one dream. Every person in India for less than $1 a month, or say $10 a year, could get 24/7 primary care, and if they wanted to have hundreds of interactions with their AI physician, for a price point that would be far below what even a poor country like India spends today on healthcare, like small, tiny percentage of that. Now that, I think, is totally achievable now in a country like India. It's definitely achievable here in this country easily. Two things have to happen. Probably the most important to do this right is to introduce it the right way. And no matter which profession, I counted 33 professions in which our firm is building AI workers. AI primary care doctors, AI mental health therapists, AI oncologists, AI chip designers, AI accountants, AI sales, like 33 professions today in our portfolio. I think we are addressing a big part of the workforce. So how should we treat this? The way to think about it is if a student graduates tomorrow from Howard Medical School, joins your clinical practice, you don't let them run wild. You supervise them. So to think of this AI in a properly done AI system, fear my son's company is building an AI primary care doctor because I think it's so important. And there's no question we can do as well as any human, including front-facing conversation with the patient, including how you minimize the number of questions to come to a diagnosis that's high reliability. But you have to treat these as AI interns, like a fresh graduate out of a medical school. Then the physician, the clinician, whose license they can practice under, oversees all their diagnoses. And over the next 5 years, they are signing the prescription because AI can't sign a prescription order. They are supervising, but the AI is doing all the work and the patient interaction.
So it's a collaboration, it's a partnership.
I think it's a leash on the AI where as it gets better and better, and as you get more confidence, you let the leash up, like you do with your dog.
So you're scratching at something that, you're an optimist, I'm an optimist, but what should we really be concerned about? Where are the risks? And the reason I'm asking, there's a lot of builders in the room, there's a lot of entrepreneurs, there's a lot of people that are moving really fast, hopefully moving fast. But what should we be concerned about? What should we be thinking about?
In healthcare, the most important commodity is trust. It doesn't matter how well the technology works. You have to generate trust in the technology. So this intern model is the right way. You're doing an AI intern pharmacist, an AI intern nurse practitioner, an AI intern mental health therapist, and you supervise them. And I think that as trust is established, then you can let it operate more independently. Trying to get to complete autonomous operation in step one is the wrong thing to do. By the way, it's also wrong to let the AI assist a human. That copilots is a really bad idea in most areas. It's what people think of. I just gave you a study that shows humans make the AI much worse. They should review the final results and approve them, and approve the prescription. That is the right model. It's a worker that does the work. And 3 years ago, we went away in our shop from building copilots or assisting any humans. Humans are just flawed. Just let them supervise till we get enough confidence, until we prove the AI does as well or better, and then you can let the AI loose.
So
a few areas copilots work, but in general, I don't think that's the right model of AI, because AI and humans operate at very different bandwidths. There's a mismatch.
different species. There's a lot of entrepreneurs. What do you tell your founders? What do you tell the companies that you're investing in? What wisdom can you share? And then I want to turn the question over to you in a second.
My answer is what I just said. First, most people, especially true in healthcare, are limited not by what AI can do, but what people think it can do. That's the big limitation.
So it's like a lack. We need a bigger imagination, or we need to leverage our imagination.
Right? So it's up to us as founders to help develop the trust and proof. I can tell you, we've done a clinical study of an AI doing mental health diagnosis, 100,000 patients, 93% accuracy in diagnosing the top 10 talk therapy diseases or CBT diseases. 93% accuracy. There isn't a human who can get even remotely close to that. but that's a 100,000 person study, so you have confidence.
Yeah.
This chatbot won't make you commit suicide.
Yeah.
Trust.
Essential to humans. Esther Dyson's here. I asked Esther if she would join our conversation, just ask a question. And Esther has a new book coming out, I just want to mention, called Term Limits, which is, in this age of abundance, where are the limits? I can't wait to read it. But Esther, over to you. Is there a mic that we can? I'll repeat it if people can't hear.
Hey, great to see you again.
Thank you, join us here.
No, it's, so I want to,
I'll repeat the question.
it requires a little Abraham Verghese, no doubt. He's used to run medical school or something, and now
He has a lot of bad ideas and bad habits.
Okay.
We were on a panel together about 10 years ago.
Yeah.
So we disagreed strongly, and almost every aspect he's been wrong and I've been right. He's talking about Abraham Verghese.
Yeah. Nonetheless, I'd like to quote something from his book.
Which is probably wrong, but go ahead.
It's a wonderful book called Cutting for Stone, about that's what a surgeon does, they cut for stone. And at some point there's a class of students and he asks them, what treatment is best delivered to the ear? Do you remember what the answer was?
No.
Okay, words of comfort. And so my challenge here is that a doctor does so much more than diagnose. And AI can do lots of things, but the second kind of notion I want to bring into this conversation, did you see the food over there?
Yeah?
It was amazing. It was real food. It was fresh. It was vibrant. It was real. And I hate to say it, but at this conference, I've been eating disgusting ultra-processed food served by people who claim to be interested in health. And in a sense, what we need is amazing AI doing diagnoses, and then real people, not ultra-processed communication, real love, real words of comfort. And so, yeah, let the AI do the diagnoses, let them do the robotic surgery, but what people need is much more communication.
So let me
Yeah.
respond to that. Let me respond to that. In 2016, I wrote my 100-page document called 20% Doctor Included. It's still on our website. You can still find it. I said 20% doctor included because I thought doctors would do the human element of care. So there was a whole section on the human element of care in 2016. And that may still be true. If you tell somebody they have 3 months to live because of their particular cancer, I suspect a human is the best way to deliver that message. So clearly there's that role, but you don't have to be an oncologist to deliver that message. 7 years ago, I had lunch with the dean of the Harvard Medical School, and I said to him, you should stop selecting for IQ. It's so hard to get into Harvard Medical School. You should look for EQ, so why don't you go to UCLA Film School and see what criteria they use to maximize mirror neurons and empathy and all that. Now, let me give you some counter-indications to that. So I still believe that may be a large role to play, and I do think medical schools should now select for EQ. The IQ they select for, most people who get into Harvard or Stanford just don't have any EQ left in that equation. The EQ imbalance is so large. But my son does this primary care thing, and the first thing they ask is a patient is, would you like to, they text message back and forth, would you like to text with the AI or opt out and talk to a human? 3% opt out and pick a human to talk to. Why? They feel much more comfortable asking stupid questions or aren't afraid to say, I don't understand, so the AI can translate it to 5th grade level, which is about the level at which most Americans understand medical conversation. Not general conversations, but medical conversation. So that's one data point. I talked about mental health therapy in these large studies. We've done 600,000 patients in the UK. We are approved as a medical device in the UK, both for diagnosis and for therapy. Most of those patients seem to prefer the AI over the humans because they don't feel judged. They don't have to lie about how many drinks they have or if they still smoke.
And you can talk to them in the middle of the night.
And you can talk to them at 3 a.m. In mental health, most of the peak period starts after 11 p.m. and goes on till 3 a.m. So this accessibility so far goes up. The other thing they found, diversity, access for diverse communities dramatically increases. For really marginalized communities like transgender, it's 150% more access to mental health therapy than if they were using their therapist. So I don't know.
And then we got to wrap
Yeah,
up after
well,
this.
wrap up. Just, everything you said, I also agree with. I think we need more care that is not necessarily medical care so that people don't get to that point. Replace the doctor.
Absolutely. Look, it's, let me simplify. Between yoga and meditation and wellness to bipolar disorder, it's a continuum. We draw a line at some point on the PHQ-9 score and say you now are maniac depressive. It's an arbitrary line. It's an arbitrary test. So moving people towards wellness is the right way to think of mental health. Thank you.
Thank you, Esther. Thank you, Vinod. Thank you for pushing boldness. We're so grateful for you sharing your wisdom and time. Thank you.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.